This is Alex Habersham, publisher of the new Macon, Middle Georgia Black Pages and Resource Guide. The 2019-2020 edition is available in print and online. So you don't want to miss the opportunity to view this book. You can see it online at www.maconblackpages.com. And if you want a hard copy, call us at the office, 478-464-0074. The new Black Pages featuring young entrepreneurs and professionals. Get
www.maconblackpages.com.
There's an old saying that says, you have not because you ask not. Well, that saying can be utilized for other situations in life. One thing you can say, you have because you ask not. And the point I'm trying to make is that if one arms him or herself with information, then he or she will find that there are projects and programs and activities out there that can assist with any kind of problem we'll have and any kind of growth we need or what have you. Well, the same applies to an individual that's HIV positive or that has AIDS, and then I really wasn't familiar with the program, but I think it's phenomenal that there is a resource of assistance for those individuals who may find themselves in that situation. And not only, there's a physical facility and other kinds of programs that exist specifically to assist those individuals. This is a call to action.
A call to action.
I'm your host, Alex Habersham, and I'm very happy today to be able to impart this information about this situation and this entity that deals with HIV and AIDS and HIV positiveness and things of that nature. And I'm very, very happy to have with me Mr. Dale Wrigley, who is the director of the Hope Center, which is appropriately named because it does instill hope with people who find themselves in the unfortunate situation of having HIV, being positive, or having AIDS. How you doing?
Great. How are you?
I'm outstanding. Tell us a little bit about yourself. You first.
So I'm newer to Macon, but I moved here 2 years ago to take on this job. I've been involved in the HIV field for over 20 years, in public health for a long time. The Hope Center is a part of the North Central Health District, which serves 13 counties here in Middle Georgia. We're headquartered here in Macon, but again, we serve all 13 counties, and the center itself has been here since 1985.
Wow.
HIV fast growing, in particular in the South, in particular among African American individuals.
It's increasing?
And it continues to increase disproportionately. And so being here was, that's partly what led me here, because I've been involved long enough and I want to be somewhere where we can try to make a difference and educate our community and also help our clients.
Okay, so you deal with both prevention and treatment, or is it essentially treatment?
The center is focused on clinical service, on care, case management, and ancillary services. But as being a part of the health district, we also offer preventative services. We offer linkage to care programs. We do testing for individuals throughout the community, not just in the clinic settings. We have 13 county health departments that we test in, but we also have organizations that we work with mobile units to test out in the field. We test at universities and we test at special events. So all of that is a part of a comprehensive care.
So if in fact an individual is curious as it relates to whether or not he or she is infected, then you all are a resource for that?
Definitely. And again, every county that we serve, all 13 counties, including Macon, have health departments. Testing, if again, has a sliding scale fee, or it is absolutely free if someone can't afford it, you can get tested at the health departments.
Okay, now, at one point, they used to say that HIV was a death sentence. You know, if you contracted it, then you may as well go ahead and do your will or your advance directive or what you call it. But it's my understanding that there has been some progress made. So just talk about the contraction and the treatment. But before we talk about the treatment, talk a little bit about Dr. Cantor.
I will. So Dr. Kantner is the medical director for the Hope Center. He is one of 3 of our contracted doctors through Mercer University. And Dr. Kantner has been our medical director since the inception of the clinic and helped start the clinic in 1985. Dr. Kantner is also at the forefront of HIV research. Was the state of Georgia's first HIV director when we were just getting started in this field.
When it wasn't popular.
And he is still there today, and he sees patients to this day. And I think we'll always have Dr. Kantner there as long as he's able to. Again, we have other doctors. Dr. Jeffrey Stevens was a student under Dr. Kantner, and today he is also on our staff as a contracted provider. And he's also the director of the medical program at Mercer.
Okay, let's do a profile on an individual. Just kind of walk me through what happens, if in fact somebody goes and get tested, and then the test comes back positive.
Yeah, so there's many places that people could find out their status. So some people may choose to go to a private provider. Some people may walk into a clinic somewhere. That could be here, it could be in another place. But just kind of that process is the state of Georgia has put in place linkage to care coordinators throughout the state. And Macon actually has 2 coordinators that assist. So whether you get tested and you test positive at a doctor's office, at the hospital, or at one of our clinics, that linkage coordinator can be called in and they can actually help talk to you about your results. So you get a little bit of extra support with this diagnosis. It still can be scary. What you mentioned earlier is that, yes, we consider this now a chronic illness. It does not mean it's something that we want to get, and it's still long-term taking medicine, but people can live a full life with HIV if, again, you are under medical care and you get the appropriate treatment.
Okay, well then I got another question for you. Talk a little bit, and then it's kind of confusing about being HIV positive and having AIDS, because there's a difference. So you can be positive and not sick?
Yeah, so the test that we test for is testing for HIV in the bloodstream. So it's actually testing for the virus. The virus is what causes the disease. The disease is actually AIDS. With medication now, we actually, if we catch HIV or we catch someone that was infected early, we can actually prevent someone from ever being diagnosed with AIDS.
Full-blown AIDS. Yeah. So although one may have contracted the virus, then there's a difference between having the virus and having what they call full-blown AIDS.
It is. Your health, your immune system is compromised more and more as the disease progresses. So again, the things that protect us, medically CD4 cells or our white blood cells protect us from colds, from flu, things like that, and we fight it off. But when HIV enters the system, it compromises that system and makes someone sick. If you don't get treatment or you don't take care of your health, then that progresses more and more, and then that can lead to other issues and other health concerns.
Can there be people walking around, who have the virus and they not know it?
There are, and we still estimate that 1 in 6 people don't know their status. So again, there's people have risk factors, or people may have come into contact with someone they didn't know. The thing I will say though is you cannot get HIV from walking around, from from hugging someone, from sharing a house with someone. That is not how you contract it. There are very specific ways that people.
Well, let's talk about those ways.
So again, it is very rare, but it can transmit from mother to child during birth. But there are ways to prevent that, and we've almost gotten that down to zero transmission. There also, again, it's blood-to-blood contact, so it's sexual intercourse between partners that don't know their status, unprotected sex in particular. And then again, mother to child through breast milk and stuff. You can't get it from kissing, and you can't get it from sharing a glass of water or soda or anything.
So does that mean that if in fact somebody who's HIV positive has a cold, and then you ask them, you drink out of that same, can you catch it from
You
that?
cannot catch it from that at all.
Well,
Not even close. There's no risk factor at all.
Yeah. Well, that's good
right.
information because a lot of people don't realize it. But then the other thing is, everybody who has it was not predicated on their own behavior. And I think a lot about Arthur Ashe, who got it from
A blood transfusion.
a blood transfusion. But
Yeah. And that's another area where, again, in the United States, we've greatly improved. So we have nearly zero transmissions from blood transfusion because we know how to test for the blood before.
Well, I want to talk, more about the specific services that the Hope Center, HOPE, offers after this break. We'll be right back. This is a call to action.
It's a call to action.
I'm your host, Alex Habersham, interviewing Mr. Dale Wrigley, who's the director of the Hope Center. We'll be right back. This is Alex Habersham, publisher of the new Macon, Middle Georgia Black Pages and Resource Guide. The 2019-2020 edition is available in print and online. So you don't want to miss the opportunity to view this book. You can see it online at www.maconblackpages.com. And if you want a hard copy, call us at the office, 478-464-0074. The new Black Pages featuring young entrepreneurs and professionals. Get it.
www.makingblackpages.com.
We're back. I am Alex Habersham, your host of A Call to Action, interviewing Mr. Dale Wrigley, director of the Hope Center, which deals with HIV and AIDS, and I'm glad that we have that kind of resource in our community. And I'd like to editorialize a little bit. There are many entities and institutions and organizations in our community that are designed to assist people with problems. It could be an educational problem, a psychological problem, a health problem, a family problem, you name it. So it has always been one of the missions of A Call to Action to impart information to the community about these resources in an effort to apprise the community of what's going on, and there's hope and there's help, and we wanted to let them know that. Let me start off on a lighter note. Have you, and it's not necessarily light, are you familiar with, I've seen some situations on TV wherein couples have said, well, let's both go and get tested. Have you?
So when I started in this field, I started on the prevention side in Southern Illinois, and I had a young high school youth group that I was working with, and one of our programs was to educate people about HIV. And one time, because everything was confidential, and back in the day there was even anonymous testing where you didn't give a name at all and people would test, and that was that time period. But this group of kids one night decided that it had just come out with an oral test, and it was just in your mouth. It wasn't a blood test or anything. You had to send it off to get the results.
Is that still possible?
It is still possible. There's actually quicker instant tests now that take only a few minutes, and you get the results the same day. Orally. And there's a little blood test that's only a couple of minutes. It's a minute test, and in a few minutes you get that result. But that group of kids, they decided they were going to test together. and they tested all of them around the table, and they all did the test, and we sent them off, and we weren't telling people status or anything like that. But what they did, it started that conversation about doing this and doing it because they knew each other and they just wanted to do it with their friends. But yeah, we have couples that can do that too. Again, it's a private thing, but but I think sharing that information with people is knowledge.
Yeah. So, are there any? Talk a little bit about prevention. Because you said, I don't know whether the incidences are greater or less, but how can we kind of get rid of this ugly animal?
Yeah. Two ways that we can move towards ending HIV. One, with prevention. Testing first, know your status, educate people, educate yourself and your community about the risk factors so you know if you need to get tested. And what we talk about in prevention now, there is a new tool in the toolbox. It's not brand new, but it's new to the public. And there is an HIV medication. It was a medication that 20 years ago was created for individuals living with HIV, but the FDA approved it in 2012 as a preventative tool. That pill is one pill a day, and it is a commitment because it's not just a pill. It's getting regular tests done. It's also, looking at some other testing stuff that you have to do, and it's called PrEP. And PrEP. And PrEP is actually a preventative medication that someone who is HIV negative can take. They can take it as long as they have risk factors, or they can take it for as long as they need to. Again, we have had people on that for 20 years.
Okay, I understand that. Now, so are you saying that oftentimes individuals know when they are in that risk factor group? Yeah. So what would those groups be?
So again, it's not who you are, but again, it's
no,
again what risk
I don't mean who you are.
Yeah.
I don't mean who you are. I mean, what are the factors that, based on research, that contribute significantly to HIV?
The largest portion of transmission is through sexual contact, and it's unprotected sex. And again, it's with partners that you don't know their status. So if
male or female? Male
or female, regardless of that. Intravenous drug use, again, sharing the needles is a very quick way. And we talk about that. It's not necessarily just illegal drugs. People share medications or injections. Steroids can be injected, and people have shared needles. Wow. These are things that put you at risk because it's direct blood-to-blood contact. So those are the two biggest ways, but again, it's just knowing your status and knowing your partner's status and protecting yourself.
You can't get it from kissing.
You can't get it from kissing. You can't. Shaking hands, none of that stuff. So that's good. And I think the other way to lead to prevention too is with treatment. We know now that if people are consistently on their medication, and medication is much less harsh nowadays to our whole system, so we can take that medication, it's good medication, and if you can virally suppress, keep the virus down.
Now that's with the virus, not the full blown.
It's with either. So if someone is AIDS or they're HIV, we can still bring them down to
with the same medication.
With the same medication. There's multiple medication. Everybody's on different medication, but we got a lot of options now.
Right.
If you virally suppress someone, 99 to 100% will not transmit the virus. So if we can suppress that virus, keeps you healthy as an individual living with HIV, but it also protects anyone that you may have a relationship.
Two people who are either with or without it can take that PrEP, then they greatly reduce or eliminate the possibility.
That's correct.
Yeah.
And the other thing is to protect yourself. The best way is to, again, abstain, know your status, and know your partner's status, and make those choices consciously.
Yeah, that's very important. So let's talk a little bit about the Hope Center. Talk a little bit about its history, its effectiveness, the processes, and the program.
Okay. Hope Center again.
That's a lot.
That is a lot. I'll try to remember.
This is a call to action.
Call to action.
I'm your host, Alex Havisham. I'm interviewing Mr. Dale Wrigley, director of the Hope Center. And now we're going to enter into the part where he's going to talk about the Hope Center.
Hope Center, again, was created in 1985. It has moved several times along that way. It was at one point housed in the Macon Bibb Health Department and then on its own building. Today it's here in Macon, but our services include comprehensive primary and specialty care for individuals living with HIV and AIDS. That means that we have infectious disease doctors that work directly with patients for the HIV, but we also know that now many people have other illnesses as people are aging with HIV. And again, 41% of our population is over the age of 50. And so we're looking at chronic illnesses like diabetes and heart disease and things like that. And so our doctors are able to help with that.
Say that again now.
Yeah.
So you mean not only do they have AIDS, but they got these other diseases?
Well,
is that what you're saying?
Not everybody is an AIDS diagnosis. So some people are living with HIV and stuff because remember, we can suppress the virus so people don't even
HIV and AIDS. Okay.
Yeah. But again, because people are living longer, our population is aging. And so again, almost half, a little bit less than half of people living with HIV, not just here but nationally, are again over the age of 50. And so we look at all those other chronic diseases because people are dealing more with those than they really are with HIV if it's under control. So we also provide dietitian services at the center. We have full case management and counseling services that we do both on-site and off-site. We also have pharmacy services that we provide to clients in-house. And there's some other social supports, and this year we'll be adding on some support groups as well, and hopefully some support groups for family, because a lot of times it's educating families and keeping families together that we want to be supportive of as well.
Do you think you're reaching an adequate percentage of your target market? You know, how many people in the community, you know, who may, well, I guess you wouldn't know about the HIV positive thing because people could be walking around with it, am I correct, and not know it?
And not know the stats. If you look at the last statistics from the state, the Macon region, again, which covers our 14 county areas, we had about 3,700 people diagnosed. That's who we know, but you're correct. Not everybody knows their status, and we don't know. And also, people move in and move out of town. People can move here, and we have clients all the time that
I guess the question I'm asking is that is there a need for the community, the general community, to be familiar with the Hope Center and what you all do?
Yeah, again, because people need to be educated, and also for their own protection too, and for their system to know that there are people in our community, our brothers, our sisters, our parents who are living here. There are individuals just like us. They go to church with us, they go to school with us, and we need to be able to know too that HIV hasn't gone away. We don't talk about it because we don't talk about the issues around it, but it is here, and it hasn't gone away. And people need support.
Okay, let me ask you this. So I guess based on the research and the innovation and the technology and what science, so I think I heard you say that fewer people, the AIDS is not as fatal, if you please, now, as it once was, say, 20 years ago.
Right. Yeah. So again, because of treatments, treatments used to, in the early days, people were taking 32 pills a day. Wow. Some of those medications, the first medications, didn't work too well. It just prolonged life a little bit. Today, people can take 1 pill a day, and that pill can keep people healthy. Again, less toxic to our systems. The early pills were very toxic to other organs in our body, and today, those have almost been eliminated.
How do they afford it?
It's a good question. The Affordable Care Act greatly increased the number of people that had access to health care, but that said, We have not, in Georgia, expanded Medicaid. There are people who are working who do not have insurance, and that limits your access. The good news is the Ryan White program, which is a federal program through the state, has an AIDS drug assistance program. And that program, which Hope Center is a part of and can enroll people in, actually covers the full cost of the medication.
Wow. Okay, let me ask you another question. First of all, I want to thank you for all you do. I got a couple more questions. And I got an observation. Let's not forget the phone number and the location, if you can remember to tell me that. Sure. But what I want to ask you now is there a mechanism through Hope wherein you got either a speakers bureau or an organization or an entity can come and get materials, film, because I'm sure that there are many entities like churches and youth groups and other community groups that would want to at least make this a part of their educational approach to inform their members and the community. So do you have the mechanism, the wherewithal to kind of get that information out to certain individual groups? And
yeah, we do. The district, again, because we're a part of the district, the northcentralhealthdistrict.org is our website. There's a link to the Hope Center page, but also to all the programs of the health department, including the prevention program, and you can request speakers or even interviews from that site. In addition,
I guess what you're saying, that although you did specifically with AIDS, the North Central Health District can assist in
multiple issues. Yeah.
I like that. Multiple. Thank you for helping me out of that. I didn't know what to call it.
Great. Yeah.
Okay, let's talk a little bit about the location.
We're located on Emory Highway in a shopping plaza. We're growing, so we have a new pharmacy called Compass. It's not quite open yet, but it'll be a part of our center.
And what is that address on Emory?
It's 180 Emory Highway.
180 Emory Highway. And the phone number?
It is 478-464-0612.
And the web address?
And again, it's the northcentralhealthdistrict.org. There is a link to the Hope Center on that page.
This is a call to action.
Call to action.
I'm your host, Alex Havisham, having informed you of the Hope Center and the different programs that are available in our community, the good news of the treatment for AIDS, not only AIDS, but other illnesses and health-related issues through the North Central Health District. This again is a call to action.
Call to action.
I'm your host, Alex Havisham. Have a great day. Hi, this is Alex Havisham, publisher of the new Macon, Middle Georgia Black Pages and Resource Guide. The 2019-2020 edition is available in print and online. So you don't want to miss the opportunity to view this book. You can see it online at www.maconblackpages.com. And if you want a hard copy, call us at the office, 478-464-0074. The new Black Pages featuring young entrepreneurs and professionals. Get
www.maconblackpages.com